Morning. Today we'll be talking about ADHD, which is something a lot of people need to know about. Thank you, Dr. Edebi, for coming on this program to talk to us. I know you're an adult psychiatrist, but we need to literally, as it were, start from the beginning because a lot of people don't know about ADHD, and those who do actually know about it in children before you start telling us how it manifests in adults. But before we go too far, what exactly does ADHD stand for?
So the ADHD stands for Attention Deficit Hyperactive Disorder. It's like the name says, it's basically characterized by inattentiveness, hyperactivity, and impulsivity. These are the three core symptoms seen in this condition, and it's a developmental disorder. So when we say it's a developmental disorder, it means that it's a situation that starts out during the developmental phase. So it is first seen or mostly first diagnosed in children. That is not to say that sometimes it is missed and then people are later diagnosed as adults, but it starts out during development between the age of 3 and 5, that's when it's noticed, but majority of children are diagnosed below the age of 13. And like I said, even though it's just these three, inattentiveness, hyperactivity, and impulsivity, it has great impact in terms of the child's functioning.
Now, that's so important. Is it a common condition?
Well, I would say relatively so. I would answer based on statistics. So between 3 to 7% of children are diagnosed with this condition. That's relatively common if you look at about 7% of children. So yes, it is.
Now, you talk about it, but to a lot of people, so what if they are not attentive? So what's the big deal? I think is the issue. After all, if the child is not paying attention, you should just beat the child or, do whatever, that kind of thing. Or make them go and stand in the corner or force them to do, that's the kind of attitude a lot of people have towards children like this. And then they just label such children as naughty. But as you mentioned, it has a huge impact on their lives, because if they are not able to pay attention when they're young, then they often miss out in terms of school and development. Can you tell us a bit more about that?
That's so true. Like you said, it's really not just a behavioral problem, even though it's manifested as a behavioral problem, but it's fundamentally a problem with the executive functioning of the brain. The executive functioning system of the brain. So it is not like the child is just being naughty, it's that the child does not have the capacity to conduct themselves in the way that, especially in certain circumstances, they may sometimes situationally behave a bit better in some situations, but generally they struggle with being, to stay in one place. So they could be restless and everywhere. That's the hyperactivity. They could be impulsive, not thinking through the answer. So they may get spanked a lot. They may get told, especially as they grow older, they often get told that they are not serious. They are not giving it their best. They are not disciplined enough, and all of these things come back to impact on the child's self-esteem. So so you have, and then a higher percentage compared to their siblings. So if you have an individual with ADHD, the person is likely going to repeat classes compared to their siblings. The person is likely going to drop out of school compared to their siblings. So all of this has significant impact. And when it's not picked early, the child goes through a lot of traumatic statements, both from parents and from teachers.
Can you just tell us a bit about that? What do they go through?
Let me share a story. So I will just call the child. I'll call the child Jane. And Jane shared. So Jane today is 14, going on 15, and she's in I think she's in year 10. And she shared. I've always known her to be a bubbly child, and she shared a story recently with me how she has many times been told by her teachers, and that one particular teacher said to her, like, because you have chosen to fail, we're not going to do anything about that. And that was the teacher trying to cover. Well, I wouldn't say trying to cover, but I was like saying, well, I would not be blamed for your failure. And Jane struggled a lot until the parents actually realized that what she was struggling with was ADHD. So this bubbly child had become, she had said every time the exams are coming, she's panicking. She can't focus, she has so much anxiety. And then because all of these things happen, kids like that may be more prone to struggle with substance abuse if you're dealing with male children and all of that. And so there's a lot of anxiety. I can't stress that enough. And there's a lot of self-esteem issue and all the antecedents that come with it because the person is struggling with starting tasks. So I'm talking about the symptoms now.
Yes.
There's also the problem with actually initiating tasks. So it's not just like the person doesn't want to do it, but it's a struggle. It's also very difficult to stay on task because they easily get distracted. So, it could be in class and then be daydreaming and just go off. Everyone once in a while daydreams, goes off, you stop paying attention, but you find yourself, you can bring yourself quickly back to the subject matter. But for someone with attention deficit, they can go off for hours, before they actually realize that they've gone off what they're dealing with. So there's a lot of struggle there. And as they grow older, the problem sometimes becomes a bit more complex with jobs, with relationships, and the like.
Now, can you take us into that realm now? What do you mean by it becomes more complex as they get older? Because there are a lot of children who, I can tell you, with this, what you're describing, you just said he or she is naughty, beat them and force them through school, and they've actually made it through. But what happens to them later on in life? How does this manifest?
Okay, so I'm just going to walk us through how it looks like, because when we say attention, impulsivity, and then hyperactivity, it just sounds like, okay, what does that mean?
Not a big deal, yes.
Not a big deal, yeah. But it literally means that the individual would struggle with starting tasks, would struggle with following through tasks, especially when there's no supervision. So most of us, as you grow older, you are able to do that. But because it's literally, someone once described it like it's not even an attention issue. It's more of an attention regulation issue, not an inattention problem. But it's like the person described it this way, that it's like watching several channels at the same time. So it's a lot of struggle to bring attention to one task. So they struggle with starting tasks. And so you find an individual with this challenge only able to carry out a task when the deadline is almost so it's almost there. And the best way to describe it is like putting a gun to the person's head and saying you have to do it now. That's only when they can start that. So you have adults with this condition also falling out of jobs because they are not able to meet up very well with tasks. Then you also have a emotional regulation. So people with ADHD are more emotionally expressive than usually more emotionally expressive. And that's why a lot of times they are often misdiagnosed with anxiety and depression. And I want to stress that they are misdiagnosed. We're going to listen to guess a story. Typically, also before I, as a psychiatrist, began to understand it, I would normally just wave anyone with ADHD aside and just say, well, yeah, just be naughty and all of that. But so those are some, and then so you find the person struggling with that, being edgy, and they also find it difficult to sustain reading. So especially what is called a working memory. So they can't really read for so long, and also retain memories that will be required in the future. So you can't really tax that person with something that they would use later on. It has to be an information that is required now. And that's why the person may come across also as forgetful, not being able to keep to time. So you have the person struggling with time management and all of that. So that's how it plays out. That's how it looks in the adult life.
Now, it's very odd or confusing, shall I say, because you expect this ADHD to have been picked up in children. So when it manifests in the adult, you know, maybe the person would have been misdiagnosed, dyslexia, all manner of other conditions. How do you narrow it down to ADHD, particularly if they, for example, did not have those signs as a child, or they were not particularly out of the ordinary when they were children?
Well, let me put it this way. Most people, so there are 3 subtypes of ADHD. So there's the inattentive type, there is the hyperactivity or impulsive type, and then there's the combined type. So in other words, the subtypes are really based on what is predominant. So there are people with ADHD that actually have something called ADD, meaning they have attention deficit disorder. They do not have the H in the ADHD. They don't have the hyperactivity. More often than not, they are the ones that get not recognized in children. And they don't get recognized until they're adults because they don't have the impulsivity, they don't have the restlessness, they don't have that going for them. And more often than not, women fall more into that group as compared to men. So women will more likely have ADD, attention deficit disorder, not attention deficit hyperactivity disorder. So that's why someone can be missed as a child, and then because also the way I like to always explain is that as a child, it's just sheer brilliance that you require to pass exams as a child. But as you grow older, there's the additional need for discipline to stay focused. So that's where it becomes harder because in year 6 down, you don't necessarily have to read to go to do an exam. But as you go higher, you have to read. And then that's where it now becomes obvious that you are struggling with the capacity to stay attentive or to stay on task. That's why it becomes more obvious as the person grows older. As against the person with ADHD that is all over the place, fidgety, restless, always up and about, impulsive in their decision making, can't wait in the line, can't wait, just like what you say, talk before they think, and all of that. That's very obvious. That is more obvious than the person struggling with ADD.
Now, that is really interesting because I'm sure a lot of people who are listening who are thinking, you know what, I might have this ADHD because particularly the ADD, because a lot of people do struggle with these challenges that you're talking about. So if a person does have or suspects that they may have this disorder, what should they do?
Well, so the symptoms I have mentioned, I think they should pay attention to, but more so, they should meet with a specialist to get a proper diagnosis because quite often too, like I said, people can also be misdiagnosed. So sometimes people actually have anxiety, and then there are quite a number of people out there that have been misdiagnosed as having anxiety and depression, whereas what they really have is ADHD. So my clear advice would be to meet with a specialist, talk with a professional about it.
Thank you. Thank you very much.
If you suspect you have.
Thank you very much. Thank you, madam, for coming on the program to share your experience with us. We really appreciate it. Can you tell us how old you are and how did you find out you had ADHD?
I'm 36. How did I find out? Okay, so I have a child who is an 8-year-old.
Hello.
Hello.
Yeah. So I realized that he had ADHD because his symptoms were very typical. hyperactivity, impulsivity. And so we went for a diagnosis and we got one. And it was in the process of getting the diagnosis, right? Filling the forms for my child, that I realized that all of these things that I was ticking, that was getting him diagnosed, was those were the things that I was dealing with, and I didn't realize myself. Prior to that period, I was diagnosed as having bipolar disorder. So when we went for the diagnosis and we were filling the forms with the teachers, with the neurologist, child neurologist, it just occurred to me that, wow, some kind of clarity, this is exactly what I was dealing with. And so the thing is with ADHD, so as the doctor was saying, it's 3 types. It's attention, it's hyperactivity, and then the combined type. And then for most women, so this, I will try not to misinform, but from my own research, for most women, it's mostly attention, right? So you can't tell, so the way that it manifests is for girls rather, and then women as they go, the way that it manifests is not in hyperactivity or impulsivity per se, it's in attention deficit, right? And then even impulsivity, but it's not showing, because if you were hyper, you would immediately see what the person is doing. Like you can tell that the person is not staying still, is moving around, all of those things. But for ADD, attention deficit, the one that is now the attention deficit type, that used to be ADD, attention deficit disorder, you can't see any hyperactivity. So it's easy to call the person irresponsible or lazy or anxious. Yeah, so it's,
Did you
it's
have those kind of labels put on
you know what's funny, right? I like to think that I'm a very smart person, and I'm not. It's actually true that I'm really I can be very exceptional, but I do have an executive functioning disorder.
Yes, Mama Lexus knows she's the best mama.
That's wonderful. I like that endorsement. You are the best mother ever. But just continue talking about yourself so that people
so that's the thing, that it's not necessarily an intellectual disability, but it's an executive dysfunction. So there are certain times when, and so people continue to think that you're not living up to your potentials, right? Because sometimes you're doing really great, and then sometimes you're slacking. And it's an executive dysfunction in the sense that perhaps you're 36, but you're functioning so what executive functioning is the ability to initiate tasks, complete tasks, time management, organization, those skills that are crucial for adults and just for living generally to succeed. And you don't have those skills, then it's a problem. It would lead to stuff like anxiety, depression, because people are going to expect you to do these things.
Did you have that?
So yes, I did. I did. I'm still very anxious. And as I said, what we diagnosed that as initially when I was younger, at about 18, was bipolar, because there were times when I would be so productive and I'd be doing really well. But there would be times when I just wouldn't be able to do it. I would not be able to start stuff. I would be slacking. So yes.
But since you can I ask, since you've found out the right diagnosis, how does that make you feel?
I don't know how it makes me feel. I'm not able to articulate my feelings because it's a process. The thing with ADHD is that there's so much that's unknown, and because there's so much that's unknown, as the person living with that, you have to do your research. You have to understand what you are lacking, and you have to then create all these coping mechanisms for yourself. It's a lot. Like, you are having to do all these things when you don't really have the executive functioning skills, So I'm not sure how I feel about it. It's great that I know that this is what I'm dealing with, but that's about it.
Are you on medication?
It's still a struggle to do all of these things. Yes, I am on medication, but the thing with medication is that it gets better. It gets better, but of course, I mean, there are times when you realize that perhaps you need to go back and then go for a review, or maybe up your dose or reduce your dose, or maybe change your dose, change the entire medication. But these are things that you'll have to settle. For ADHD, you have to really be self-aware, that sort of thing. You have to know what's working for you. It's almost like what I do is observe myself every day and see what's going on with me when I take the medication, or when I am not on medication.
Thank you so much.
And all of that.
Thank you so much.
Yeah. So
sharing this has been wonderful. We really appreciate your sharing your experience, because it's something that a lot of people don't know and don't understand. If I can ask Dr. Edebi to step in here now, because we don't have that much time left, and say, our guest shared with us her experience, and it's actually fantastic that she's had the proper diagnosis made after all these years, but she's still challenged with treatment. So for those who are listening, who are listening and thinking, I have this. If I come and see Dr. Edebi, what do I, well, is there an end in sight? Is there effective treatment? How can we, is there a resolution to this problem?
Okay, well, this is how I would like to say it from the doctor's point of view. First things first, is a chronic condition. So it's a condition that is managed, not a condition that is cured. I think that's very important. So in terms of treatment, there are medication treatment and non-medication treatment, but the mainstay, especially for adults, it's actually the medication. And there are two types of medication, the stimulants and the non-stimulants. We have quite a number of, I'm not going to call the names so that someone doesn't go from here.
Yes, exactly.
Just go get the meds, but the stimulants work a bit faster. And then there are different types of stimulants. They have quite a number of stimulants available. And it's usually effective for about 80% of people. That's people who have been diagnosed with this condition. About 70 to 80% have very good response to the stimulants. They often describe that they're able to concentrate better, they're able to carry out their functions better. At least there is a significant difference when on the medication as against when not on the medication in terms of being able to function better. And then you have the non-stimulants. And the non-stimulants are usually used in cases where maybe the individual did not respond very well to the stimulant. And I think it's also important to note that it's a spectrum. So you can be anywhere on the spectrum. So some people have more symptoms than others. Some people may not fully meet up with the entire criteria, but they see traits. And then there's non-medication treatment, which is more behavioral management. And that is more for children. And then it's very important to also say that for children below the age of 6, it's more behavior modification. And for the behavior modification, behavior program, as it's called, it's more the parents have to be involved. So it's not like you give a therapist to train your child. Rather, it is the therapist trains you on how to best manage the child's behavior. So that's basically the treatment option. And it's an ongoing thing. So it's something that we keep getting better information about, and we keep working with those who struggle with the condition to get the best outcome.
Now, can I ask, because I know people are listening to this and knowing that they have these anxiety issues and knowing and hearing these drugs, does it make them better? Because a lot of people who are dealing with life, life in Nigeria is already so stressful. Anxiety and depression is actually part of the cause for what a lot of people are going through at the moment. So it's not even, so how does it make the person better? Is what I'd like to know. Does it make them cope with their work better? Does it make them a more productive person? How does the treatment help?
It varies from individuals to one individual to another. Some individuals have clearly said, just being on the medication, they've been able to carry out their tasks that they've left unattended to for several months within weeks. So and some individuals have described their experience as someone once said that it was when I took the medication, it was like I used to be in a noisy room, and now after taking the meds, suddenly the room became quiet. That way I could focus a bit better. So what normally would happen, it's like I mentioned earlier, it's an executive management function system. And challenge, the problem is about with the executive function, the part of your brain that subsides for decision making, planning, and all of that, working memory. So when they take the medication, it helps the brain to be able to carry out those tasks. So there's usually improvement in focused tasks, being focused on the tasks. That improves. There's improvement in being able to sustain their reading. So for a student, the student is able to stay on the subject much better than in the past. Because in the past, after like 30 minutes, the person has wandered off and goes off for hours and then comes back. So they're able to do that much better. There is definitely a significant improvement
now,
when medication is used.
This is actually such an important topic, and unfortunately, we've actually come to the end of the program. But if anybody wants to, for example, contact you to find out if maybe they've been misdiagnosed or if they have an issue, can you give us a phone number that they could contact?
Okay. Okay, so that's 090-7840-8485.
Okay, can you just repeat that?
090-7840-8485.
Well, we've come to the end. Thank you very much. We've come to the end of the program. Do you have any last words for our listeners?
Well, I would just say that information is key, and it can make a world of difference getting the proper diagnosis than to be treated for something that you don't have. So,
okay, thank you very much. And a very big thank you to our guests for giving us a personal insight into this issue. And we hope that this program will actually be, as it were, a light for a lot of people and help them through.
Thank you for watching. Please like, share, and subscribe for new video updates.